Okay. Hi, I'm Edwin Rutsch, Director of the Center for Building a Culture of Empathy, and we're going to be talking about empathy here. I'm with Alexandra Smith, who's a licensed professional clinical counselor based in Minneapolis. Is that correct?
Yeah.
And what we're talking about is an article you wrote that's called 5 Tips to Cultivate Empathy, and the subline is practicing empathy is an essential step to resolving conflict and developing meaningful relationships. And here are 5 ways to activate empathy. So is there more you'd like to say about introducing yourself before we dive into the article?
Sure. Well, I guess I'll just give a little bit of background around me. I'm a licensed psychotherapist and also a freelance writer. So I write quite a bit about mental health, including this article that you are referencing.
Oh, great. Yeah. So I really enjoy talking with clinical people who are doing clinical, work because, you're right there doing the empathy, you're having to actually practice it. And I talked to a lot of academics and, they have all these academic ideas, they shuffle ideas around, but they're not sitting down there actually sort of applying it, like a clinician. So glad to talk to you about that. So maybe we could start like, how did you get interested in empathy to begin with?
hmm Um, that's a good question. When I was in grad school, I remember reading about Carl Rogers and his approach to therapy and thinking, oh, that's nice, but it's not going to work. It's not going to be enough. I'm more of a kind of a logical person. That's sort of how I'm more oriented. So I really gravitated initially towards more of like the CBT approach.
Mm-hmm.
And then when I actually started practicing, my first clinical experience as an intern was working with perpetrators of domestic violence. And when I went into that work, I imagined that if I just kind of questioned people's behavior and pointed things out, this is a cognitive distortion, that would be enough to make change. And what I learned was that it wasn't enough, that I really needed to build a relationship with these clients because pretty much all of them were mandated to be there. Um, and that if I wanted to build that relationship, I really had to really actually learn how to use empathy. So to sit with someone to really try to understand where they were coming from, why they did the things they did, um, and just to not pass judgment. I mean, that doesn't mean condoning behavior, but to just be able to sit with someone and let them share their story and be there with them was how I actually built those relationships and ultimately how I think I was effective in the work. And so that was a really great learning experience for me. I continued to do that kind of work for a few years. And I think the more that I practiced as a clinician, the more I realized that empathy is just so important in building relationships. It's hard though. Like it
Mm-hmm.
takes work, right? And it can be exhausting. So it's been an interesting journey of kind of learning how to use empathy in my own life. And then as I've been doing more and more of my writing, and kind of learning more of the research around empathy, I've also, I think, gotten more interested in it because I think it's more, in some ways, it's maybe more complex than it seems on the surface.
Yeah, well, that seems to be 2 different approaches I see. As one is sort of the empathic approach, the listening, sort of like Carl Rogers, non-directed, kind of giving space, putting an effort, uh, on the listening, versus sort of a questioning approach where you ask questions and you try to get. It's kind of 2 different ways of sort of getting to the truth, and it's really interesting you're kind of setting those up as 2 different methods. I've seen that too, and kind of seeing the importance of the empathic approach.
Yeah.
Yeah, interesting. So, in terms of the empathy, how are you defining it? Because if it's like there seems to be so much confusion about what people are meaning by empathy. And there's terms like affective, cognitive. I mean, it goes on, and even the subsections of it are confusing and used differently. And so, I just kind of wondering how you kind of are defining it.
hmm Yeah, I agree. I don't know if there's one official definition of it. So for me, I think of it as really putting yourself in someone else's shoes. Feeling with someone can be part of it too. Like you said, people talk about the cognitive versus the affective components of empathy. I don't know that I can fully perfectly define the difference, but I think of the cognitive piece as kind of imagining what it would be like to be in someone's shoes, right? To be in their mind. And then the affective piece is the feeling that emotional experience with them. So sort of vicariously experiencing that with them. I think they all kind of, it kind of all goes together
Hmm.
and fits into this idea of imagining and feeling what it's like to be another person.
Yeah, I don't like the terms affective and cognitive empathy. I think those are newer terms that have come up, I think just in the last 10, 15 years or so. And I use the definition of Carl Rogers.
Mhm.
That's sort of like the foundation kind of thread that I follow, which sounds like maybe you have looked at too. It's just
Mhm.
sensing into someone's experience, being present with them. Is like as a clinician, you're being with them, you're listening to them, you're maybe using active listening to just be present with them. And so I see that as sort of the basic, empathy, feeling into. And then the cognitive, I like the word imaginative empathy. That you
Mm.
can you can imagine yourself as anything. I can imagine myself as you. I can imagine myself as someone else. I can imagine myself in the future. I can imagine like I could imagine myself as a piece of fruit, or just whatever. You can just put yourself into any situation, into any role, and imagine what it's like to be in that context, and see, it's kind of like an actor basically, and imagine like Meryl Streep being Margaret Thatcher or Julia Child. You're kind of feeling into that
Mm.
situation. So that's kind of how I tend to define it. So does that kind of resonate, or how does that land?
Mhm. Yeah, yes to all of the things you said, and with Carl Rogers, I think his use of the word accurate empathy also, again, something that I don't think I really understood until I was practicing. Like, some of that is really asking people to explain and walk you through their experience, right? And to really ask those open-ended questions from a place of curiosity and make sure that you're getting it right. So when I'm working with somebody, I will oftentimes really say back what I'm hearing and ask them if I'm hearing them correctly. And if I make an interpretation, I want them to tell me if I'm getting it wrong. So it's not just, I guess it isn't just feeling with someone, it's also really trying to do the hard work of understanding them.
Mm-hmm. Okay, so you're listening to someone, you're trying to understand them, and I was hearing maybe using that active listening, so the
Yeah.
empathic listening, where you're trying to be accurate in terms of what you're hearing. You reflect back, you're understanding to sort of check, am I hearing you correctly, and then person will usually add more.
Yes, exactly.
Yeah.
Exactly. I would also say too, and I'm not perfect at this, but I think bringing some humility into it is important. Um, recognizing that you don't ever really know anyone's perspective, and that you don't. I think sometimes in our field we can assume that we know better
Mm-hmm.
than people,
Mm-hmm.
and we may know more about certain things because of our training than somebody else, but we don't ever know someone's story better than they do. And so really coming from a place of humility, I think, is a important component of having real empathy.
Okay, so just be humble. Like, I don't know, fully understand, know your position. I'm not going to kind of project something onto it. I'm
Mhm.
going to just realize I just don't know, kind of have that fully know. I mean,
Yeah,
yeah.
yeah. I don't know if you were ever into Anthony Bourdain, his his shows.
I know of him, but hadn't watched it. No.
Sure. So he's passed away sadly, but he
Hmm.
was a real hero of mine because he, I think, approached people and cultures with this very genuine humility, and a great sense of humor and curiosity. But he really came into situations like, I'm not here to know better than you. I'm here to understand
Hmm.
you. And I think that's not something that everybody practices, and it's to me it's such a wonderful, beautiful quality to cultivate.
Okay, so Great. It sounds like he's a role model for sort of this empathic way of being. I'll have to look that up. Look up some of his shows. Make sure it's on YouTube. So maybe we can just go through the 5 approaches here. You see, you start off a shift into an empathy-ready mindset was number 1. You wanted to say a little bit about that?
Yeah. So I think one of the really important things to remember with empathy is that it's really, really hard to practice it if you're feeling threatened, right? If you're on the defensive, because your natural instinct is kind of fight or flight, protect myself, right? And so oftentimes we don't realize when we go into situations that way. And especially if it's someone who maybe we disagree with, we kind of subconsciously go in ready to be on the defensive, right? And so taking some time to relax your body and kind of open up your parasympathetic nervous system, so you're coming into a more relaxed, kind of open physical place, by taking a few deep breaths, letting your body soften. That's a really good way to shift your mind as well. So you're now coming in not with this defensive stance, but with a much more sort of open and curious mindset. So I think that to me is always an important first step.
Well, usually fight flight is sort of a response to fear, right? If you're feeling afraid, you have fight, flight, freeze are sort of
Mhm.
responses. And it's like, how do you calm down that fear, maybe, or anxiety?
Yeah, yeah. And I always tell people the best way to do that is first through the body, right? We have a lot more control over our physical processes than our mental in a lot of ways. So if you take some time to slow your breath, relax your muscles, maybe do a little bit of grounding exercises, that shifts your mindset, right? So you're then able to, again, access that empathy.
Okay, great. So that's the first step. Ask open-ended questions. This is 2.
Yeah. So again, that curiosity. I like to say, tell me about, help me understand, say more about that. So you're letting the other person lead essentially, and you're kind of following where they go.
Okay, well, I hear a lot about curiosity, like, oh, be curious, but how do you be curious? You know what I mean? It's like that's a mindset in it of itself. Like, why are you curious? You know, where do you get the curiosity from? What sort of cultivates that curiosity?
Mm, I don't know. That's a good question. I mean, I'm a curious person by nature. I don't. I've never really thought about how to cultivate curiosity. I think it is a choice. It's probably a muscle you have to flex a bit. Um, because it can be easier just to not be curious and just to kind of stick with what you know or what you're familiar with or comfortable with. Um, so yeah, I don't know. That's a good question. I've never thought
Yeah.
about how to become more curious. I would just say that I think curiosity is a good quality.
Yeah, well, I know I'm curious because I like to see there's sort of that humanity. It's like, wow, this is really there's this humanity when I see people. It's like there's a curiosity because there's this common humanity that I see in people, and it's like I kind of learn from their stories and their experiences. So I think that's one thing that is kind of drives my curiosity. Yeah.
Mhm. Mhm.
So
Same. Yeah.
yeah. So okay, then we had ask open questions, practice active listening. Number 3.
Yeah, I think this is probably the hardest one for many people, and I'm one of them. You know, we're so used to listening to respond, um, rather than listening to understand. And so active listening is you're really putting yourself kind of on the back burner and you're focusing on making sure you understand the other person. Um, and I don't know why that's so hard, but I think a lot of people find it hard, right? We oftentimes go into sort of like solution mode, right? Especially if someone's telling us something that's hard for them, we want to jump in with, well, have you tried this? Have you tried that? And just to listen and really make sure that we're getting their story right. I think it takes a little bit more work. And sometimes it means you're sitting with discomfort, right? If somebody is really sad or angry, or their story is really terrible, to just sit and really listen without judgment, without, again, wanting to respond, it's hard.
Yeah, you're sort of sitting in the pain, maybe
Yeah,
sometimes like,
yeah.
hey, it's painful here. Let's go do something else.
Exactly, exactly.
Yeah. Well, the active listening is, from 14 years of, working on this topic of empathy. It's kind of what I've kind of landed on as sort of the foundational skill or practice, way of being. So, I do something called empathy circles, which is based on, Carl Rogers' active listening, but taking it into a relational, like taking it out of the therapeutic, and just that we have an agreement that we're going to use empathic listening, active listening with each other. So we have a group of like anywhere from 3 to 6 people come together, and they do, one person speaks on the topic, and then they select someone to speak to, and that person reflects back their understanding of what the speaker has said. And we have take turns, like maybe 5 minutes, until you kind of have that back and forth, speak, get a reflection, speak, get a reflection. And then when the speaker, the time is up, or they feel like they've been heard, then it's the listener's turn to speak to someone in the group. And it just goes around like that for like 2 hours. Is sort of a practice, a way of sort of practicing that active listening. And I found it the most effective, first step, sort of gateway practice, for the whole kind of empathy, sort of mindset. So yeah, I don't know how that lands.
Yeah, I mean, it makes me think of my counseling skills class in graduate school, where so much of it is just, I mean, obviously there's a lot of techniques that you use as a therapist, but really so much of it is just learning how to listen and to, like you said, offer those reflections. So here's what I think I'm hearing. It sounds like you're saying this. It sounds like you were feeling that. And then again, giving people a chance to let you know if you're getting it right. To me, there's a bit of back and forth in active listening.
Yeah, what have you found as a listener? I'm always looking at how to listen better. I always feel like, oh, how do I really listen and, be able to reflect better? I was wondering if there's any sort of insights you've learned about for yourself, like how do you stay present and
Mhm,
be, what's been effective for you for doing that listening, sort of that inner mindset that you have.
mhm, mhm. Um, do you see my fidget?
Uh-huh.
So I try to always have a fidget in my hand when
Uh-huh.
I'm doing therapy or having a conversation with somebody, um, because it is really easy to get distracted. And having a sensory kind of anchor for me is a way to keep myself more grounded in the moment. And I think because of that, I'm better able to listen. Um, and I think some of it also just practicing mindfulness, which is hard, but we do our best just to notice when your mind's wandering and to pull it back, because we all do that. To try to go slow and not feel rushed, which is something I struggle with, but I do my
Mm-hmm.
best. Um,
Do you know
yeah.
where is your attention? Like when you're listening to someone, is your attention like on them, fully on them, or are you kind of like reading? I mean, I kind of experiment. Like I kind of feel into myself and try to read what the person is saying and how they are in sort of my own body.
Mhm.
Versus, I mean, I have different, kind of experimenting, but or do you just kind of stay present and kind of more mentally kind of reflect what they're saying? You know what I mean? It's like, where is your awareness? I'm hearing one thing, you have your awareness. That's pretty cool. I might try that. Something in my hand, and just that you can have a tactile awareness, because that's bringing the awareness to your hand, right? Into
Yep,
your
yep.
body. So you're bringing your consciousness into your body that way. And so I wonder, where else do you keep your awareness? Are you, when you're doing that listening?
I mean, but it's both, right? I
Mm-hmm.
mean, I think I'm not really consciously thinking about my fidget as I'm playing with it. It's just sort of a way. It just helps me stay grounded in the moment, so
Mm.
that I can be tuned into the words, the physical presence of another person. Um, so it's kind of both for me. If I mean, it may be different for other people, but I do have a tendency to get distracted. And so if I'm not fully grounded in my own body, it's harder for me to be
Mm.
present with somebody
Mm-hmm.
else.
Hmm. So I imagine maybe I'm gonna try that. Think of my breath or something. Like,
Yeah.
okay, I'm speaking, listening to you, and what's my breath? How's my breath or something? Yeah, that's all great. Thanks for that tip. So let's see. Recognize the limits of empathy.
hmm Um, I think this was something that came up in a conversation with, oh, I can't remember if it was Maya Salovitz or Susan Lanzoni, who you've interviewed. I reached out to them for that article actually, and they were talking. One of them, sorry that I don't remember who, had talked about how important it is to kind of like I was saying, have some humility, recognize that you can't really truly understand what it's like to be somebody else. You just can't, right? And so to acknowledge that is fine. Actually, I think people really appreciate that, just to be able to say, I can only imagine what that must feel like, right? Um, that again to me is another way of sort of I guess being continuing to be curious and come from that stance of I don't necessarily know. I may never fully know. I just want to do my best to understand.
Okay, so that's that curiosity, and then I think maybe that humble humility
Yeah,
that you're talking about too. Recognize, oh, I don't fully understand who you are. I'm going to keep kind of being present to try to understand that, and not try to, you know, have some kind of firm idea, judgment, or something about who you are.
exactly.
Okay,
Exactly.
cool. And then the number 5 was pass it on.
So this one is about helping other people, especially specifically kids, cultivate empathy. So reading, watching documentaries, having conversations, or spending time with people who are different than you, have a different life story, life experience than you. I think it's a wonderful skill to build early. And there's so many ways to do that, to build empathy, right? To be curious, to be humble, to ask questions, to try to understand, and what beautiful qualities to cultivate in a child.
Yeah, well, I've done empathy circles with my nephews and nieces. And they're like 5, 6, 7 years old. So already at that age, they're able to sit down. Like I remember there was a fight between my niece, who's like 5, and my nephew, 7. And I sat them down. So, okay, let's use empathy circle. And I kind of did active listening with each of them, and then had them do it with each other. And, they're kind of rambunctious. It's kind of hard to get them sometimes to settle down. But at the end, my niece said, I like empathy circles. Let's do it again. She liked it because she wasn't getting beat up by her brother, to solve the problems. Speaking about beating up, maybe we can talk a little bit about your work with domestic violence. Do you want to say anything about that, and how empathy has worked? And that's a very difficult area. And how is that? You wrote about your personal experience working with people who have perpetrators of domestic violence. How has empathy sort of worked in that area?
hmm Um, well, like I was saying, I think from a clinical perspective, you really can't be an effective therapist if you don't have trust, if you don't have a relationship with the client. And to build that relationship, especially with people who are coming in very defensive, not wanting to be there, and really feeling used to being maligned, and honestly feeling a lot of shame in themselves, whether they're aware of that or not. Empathy is really a way to open doors with people. The population that I worked with, I worked at a place called the Domestic Abuse Project that's based in Minneapolis, and the population that I worked with was very largely individuals from very disadvantaged backgrounds. I would say 95% of the men had experienced a lot of trauma themselves, often a lot of abuse themselves in their own childhoods, and were part of a system that kind of labels someone as a certain thing based on behaviors that they did. And if you come into that kind of work with a sort of um, teacher student mentality, I don't know that you're as effective as at really helping people understand themselves and make change in their behaviors than if you come from a curious, empathetic place. And again, it really took me working in that world to learn that. I don't think you could have told me that going in and I would have really gotten it. It took trying the sort of teacher student way of being and seeing that it didn't really work, and recognizing that when I just sat back and said, help me understand you, like where did you learn this stuff? We actually would ask the guys often, like, tell us about where you learned some of these things. Like, what did you see growing up? How was it dealt with if your dad hit your mom? How was it dealt with if somebody hit you? Did anybody care? Did anybody say anything? What was the response if you started crying? Were you told to shut up and be a man? And then how do you think that affected your ability to feel emotions with other people? Right. And I was so amazed by how, as I really kind of sat back and asked questions and listened, I formed these really beautiful relationships. And then I saw a lot of these clients, not everyone, but many, really being able to start to practice some self-compassion, which doesn't mean I get to excuse the behavior, right? It's that I can understand maybe where that came from, and I can shift from a place of shame to a place of guilt. I don't know if you've heard the difference before, with
Yeah,
shame being
Brene
like,
Brown writes a lot about that.
exactly. So it's not I am this bad person. It's I did something bad. I'm not okay with it. I can be better than that. I don't think it's possible to feel. I don't know that people can feel empowered to do better if they don't believe that they are capable of better. If they've convinced themselves, I'm just this bad person who does bad things, right? Then why would you try to change? So empathy helps people cultivate self-compassion, um, and that's really the step towards change in my experience. And then there's skills, right? Then there's, okay, how do you learn to take a break? How do you learn to tune in your body when you're getting angry? How do you learn to walk away before an argument happens? How do you learn to have a constructive argument with somebody? How do you learn to have empathy? The other thing too that was so cool about that work was that most of our treatment was in a group setting. And so group work is super cool because you're actually practicing empathy. Everybody in the room is able to sort of practice empathy together, right? You're listening to other people's stories. The group members are too. And so they're getting to practice what it feels like to empathize with another person and what it feels like to experience that being given to them. And you just see it. It was incredible to see that shift in people. Again, not everybody, but many, many people over the course of, it was a 24-week program. It was a long time. Over the course of those, months, you would see people really, really, really shift. And it was life-changing for me. It really changed how I approach my clinical work too.
Wow. So what is it that you're doing now? It sounds like you're not doing the domestic violence work, or what
Yes,
kind of work?
I work in an outpatient clinic. So I'm kind of a generalist. I see all different kinds of people now. I still sort of have a soft spot for people with more like complex childhood trauma and maybe behavioral issues, if you will. But right now I'm sort of running the whole gamut with my work.
Okay. Well, in terms of the domestic violence, I see some practices like the empathy circle, bringing sort of these practices into the family is something that's sort of needed. So if, if people were like, even in school, kids were already learning how to do just simple active listening, to take it out of the therapeutic world, just into how do we, navigate, have these constructive dialogues, learn these skills, be heard in the process. And then if you're heard, you're able to listen to others as well. So that's sort of what I'm really focusing on now, is kind of like taking this practice and just spreading it as widely as possible. So, yeah.
Well, I'm so glad you're doing that. I mean, I will tell you, I can't say how many people who went through that program would say, I wish we had learned this in school.
Yeah,
Right?
right.
Because it's not skills that most people do learn. I mean, if you're lucky enough to come from a family who, you have parents or teachers or other mentors in your life who really help you cultivate these skills, that's great. But many people don't. And then you can get into some really
Yeah.
destructive patterns.
Yeah, well, I'm looking at how do we kind of bring it into political world. So I'm trying.
Mm,
My congressman has said he's willing to take part in an empathy circle. He's Democrat. Do it with Republicans, and how do we sort of spread it among the politicians so we have them actually model it. So I just imagine if we had the politicians modeling this constructive dialogue, that it would people would see it, and then that would kind of help sort of spread it throughout the culture.
mhm.
So that's kind of one of the projects. And we've also done this empathy tent. I don't know if you saw that on the site, but I'm here near Berkeley, and we have the political right come, to demonstrate. And then we have the counter left, Antifa and so forth. And they come and they have these knockdown, drag out fights. And we set up this empathy tent and try to listen to both sides and try to bring the sides together in empathy circles to dialogue with each other. So it's really about taking it. I think a lot of these skills have been developed, like with Carl Rogers in the therapeutic realm. It's really like, how do we take it out of out of that world and really change the culture to bring this mindset into the culture at large. So I don't know if you
Yeah.
have any thoughts on that, like how to really sort of spread
Mm.
sort of empathy throughout the culture.
Well, what you're doing is a good start. Yeah, I don't know. I mean, I think, I guess I just feel like these conversations happen so much better in person. Um, so this year has been hard. I mean,
Hmm.
as a therapist, I'm doing all
Oh,
my
hmm.
work online right now,
Right.
which is not always easy. But I think really um, encouraging more face-to-face dialogue is where it probably starts. This works, right? Because you and I are essentially face to face, even if we're across the country from each other. But certainly the sort of online comment section stuff is not very helpful in
Mm-hmm.
cultivating empathy. So I think whatever can be done to try to get people together and to slow down and to try to come into these conversations not with the intention of I need to prove the other person wrong and I need to be right, but I just want to understand. And if I don't agree with the person at the end of the conversation, that's totally fine. I didn't agree with a lot of the things that my clients believed when I worked in DAP. I certainly didn't agree with things that they did, but I could understand them better. And I think that it's hard, but it's just a happier place to be,
Mm,
frankly. Like
yeah.
it feels better
Hmm.
than just being angry and outraged and you know kind of hopeless that I think a lot of people feel.
Okay, well, great. Well, this is any final kind of thoughts before we close?
Um, I guess I would just say thank you for what you're doing. It's so important to, like you said, kind of make this stuff real. So thank you for doing what you do, and thank you for having me.
Okay, well, thank you for taking part.
Sure.